Brian came to see me with trouble urinating. He was waking up a number of times each evening to urinate. He had a slow stream. He had to wait a long time to get started. So when he first saw me in the office, we noticed that he was not emptying his bladder completely. We discussed a number of different options. His urinary troubles were really bothering him. So we elected to proceed with 2 separate medications for his prostate because he had a very large prostate. So we started him on those. He then came back to see me in the office a number of months later. And at that point, he was somewhat improved on the medications. He had some side effects, and he was not terribly pleased. He had a very poor quality of life. He was very frustrated with his urinating, and at that point we began to discuss other options. He wasn't emptying his bladder well, and one of the problems if someone isn't emptying their bladder well is you have to go back to the bathroom in an hour or two because you haven't gotten all the urine out. So we sat down and we went over a number of different options for him, and he ultimately felt that the laser prostatectomy was the most appropriate procedure for him, the one he felt most comfortable with after going over the benefits and pros and cons of the various different options for him. At Aurora, we offer a number of different options for men with urinary troubles. In general, the first thing we seek to do is see if there are some lifestyle modifications that can perhaps change their urinating. We see a lot of men who are drinking a number of cups of coffee every day, who drink a lot of soda and energy drinks, and often simply modifying that behavior will take care of the problem. The next step typically would be medications. In addition, we have office procedures that involve no anesthesia that we can do, and there are some small surgical interventions that are day surgeries. And finally, some patients need a more invasive procedure which may require admitting to the hospital.